Take a look at this rubber ring. Do you think that sitting on this rubber ring, if you've got hemorrhoids, will relieve them and fix them or make them worse? What do you think? Hi, I'm Michelle, and actually the answer to this is sitting on a rubber ring is actually going to make your hemorrhoids a whole lot worse. Fortunately, there are a lot of things you can do at home to fix your hemorrhoids and to stop them worsening. And today I'm going to guide you through some of the key strategies that you can use at home to fix your hemorrhoids, to stop bleeding and to stop pain. And these are all things that you can do at home. Now, I need you to use your imagination here to start with. I'm going to get you to imagine that's your anus and this is the hemorrhoid. So, obviously with your hemorrhoids, it's a swollen vein, a rectal vein, and sometimes they can push out of the rectum like that, the external hemorrhoids, or they can actually be inside the rectum and also to cause a lot of pain. So we know that there's a number of things you can do, and a lot of these things are to do with bowel management. So I'm going to be talking today about bowel management, about general exercise, about how to empty your bowel, and also to dietary management for hemorrhoids. And I'm going to go through the best topical ointments that you can buy over the counter, as well as ways you can give yourself immediate relief at home. So let's get started straight away. The first thing to note is if you're sitting on the toilet at the moment using your mobile phone, I want you to put it down straight away, because if you sit on the toilet for longer than 3 minutes, it actually is going to cause yourself to strain, and actually you're going to be having that sort of effect, if I can demonstrate, pushing down on the hemorrhoid, which is what you don't want. Emptying should be a maximum, it's a noisy hemorrhoid, so emptying should be a maximum of 3 minutes. If you can't empty within that 3 minutes, get out of there, walk around, and then come back. So I'm going to give you some strategies to help you empty within that 3 minutes. So what are you going to do? So the first thing we need to do is go through the correct technique to avoid straining, because constipation and straining are the biggest causes, along with diarrhea, of hemorrhoids. So to empty your bowel properly and safely, you need to do a number of things. You need to sit yourself nice and tall. You need to lean yourself forward, inward curve in the lower back. And then you need to open up the anal sphincter by taking some deep breaths into your belly. And that actually opens up that anal sphincter and allows everything to push out. As opposed to if you pull in through your tummy, what you do is you tighten that anal sphincter, and that makes the pressure greater and on the actual hemorrhoid. So then thinking about breathing deeply into your belly, so you can take a couple of deep breaths into the belly in that position as you lean forward, and then you make your waist wide to push and bulge your tummy forward, move to poo, and you can check the video above for the details on this. So making your waist wide, bulging your belly forward, and then drawing up through your pelvic floor, through the back passage when you finish. Now that's key. Now the only way that technique is going to work is if you have the right stool consistency. If your stool consistency is too hard or if it's too runny, then that's going to be really challenging and going to make the hemorrhoids worse. So how do you fix your stool consistency? This is a big question, isn't it? There's some really great research, and I've looked into the research in preparing for this video, and a recent Cochrane review found that the best laxatives or the best type of bulking agent you can take is either psyllium or asphaga husk. So I've got some here today to show you and to talk to you about how to actually use this. What this does, these are natural fibre, plant-based solutions, and they actually bulk the stool and they soften it and help the stool move through. And what the researchers found is this actually reduces bleeding with hemorrhoids and also reduces pain. So the things you can do, you can get these things over the counter. This is a psyllium husk. It actually looks like this. Oops, I've spilled it on my leg there. So it's just a fine grain. And I like the natural psyllium husk, but you can also, and you can normally get that from health food shops, but you can also get that as Metamucil. That's also psyllium. I prefer to get the natural grain because it's inexpensive, it's over the counter, it doesn't have some of the irritants that some of the other products also have. You can also take Normafibe, which is the other type of Stersilia, which is also to the plant-based grain. If you're like me and you get really gassy having psyllium, which I can't tolerate, you can also use something like your osmotic laxatives, like your Movicol, your Osmolax or Miralax in the US. And again, that's with a sachet. You have a sachet. You can have a number of sachets. They come like this, and you mix them with water. Now, the important thing is, if you're actually taking these bulking agents, is that you have additional water. So if you're having 1 teaspoon of psyllium, which is what I'd suggest you start with, then you'd have 1 extra cup of water a day. If you're having 2 teaspoons, then 2 extra cups of fluid a day. Be really careful that you just start with your 1 teaspoon. I normally suggest having about 2 teaspoons a day to soften the stool. And you can have that over your yogurt or with your cereal, because it's actually not that palatable to have on its own. But that's a really great product to use, cheap, inexpensive, and really helpful. So that should help you as well. I've got a video linked above if you'd like some more information on foods to soften the stool. Now, if you're someone that suffers from diarrhea, you might also try the psyllium, because it actually can tend to bulk the stool. And also too, your products like Loperamide, Imodium, which are usually available over the counter too, and that will slow down gastric motility. So they're 2 really important things to know about managing your stool. If we talk a little bit more about diet for hemorrhoids, it obviously involves foods that are going to soften the stool. So the average American adult has about 15 grams of fibre in their diet a day, and the goal should be really 35 to 38 grams. Now, I'm not saying to go out and have a whole lot of fibre, because if you do that while you're constipated, it's going to make things worse. You need to relieve the constipation first through one of the methods I talked about earlier, by maybe your Movicol, your osmotic laxatives, or speak to your pharmacist about that, to clear the pipes first of all before you gradually start to increase your fibre. And that's the key point, gradual increase, not sudden. If you suddenly increase your fibre, you're going to make your constipation and straining much worse. And also too, if you suddenly increase fibre, if you suffer from diarrhea, it's going to make your diarrhea worse as well. So gradually increase your fibre, and then increasing the foods that will actually help with your stool. And again, that video is linked above too. Now, let's move on to the topic of general exercise. Now, general exercise is really important. Just because you've got hemorrhoids doesn't mean you need to stop exercising. General exercise will actually improve stool movement or improve your gastrointestinal motility and help your bowel movements, but it's a matter of choosing the right exercises. So the right exercises are things like your low impact exercises. So exercises that involve one foot being in contact with the ground all the time, or exercises like cycling. You can do your walking, and rather than doing walking for half an hour, split your walks up to 3 lots of 10 minutes. And that way you're actually putting much less pressure on the hemorrhoid and giving yourself a time to relax, and not putting too much pressure on that hemorrhoid and not pushing it down constantly. Exercises like swimming, those things are also too great. If you're exercising in the gym, watch your wide, deep squats. And I do have a video linked above on how to squat safely in the gym with hemorrhoids. Obviously, reduce the weights that you're lifting so that you're not straining when you're lifting. And things like, if you're thinking about your squats, vary that or change that to a lunge, which is going to be much safer, still get your leg strength going, but much safer than your wide leg squats. Now, let's talk about over-the-counter medications, because some of these can be really valuable, especially in terms of immediate pain relief, and also too cheap and ineffective ways or inexpensive ways of getting relief. The product I want to talk about is Anusol. Now, Anusol is a lubricant. It gets inserted into the anus and it provides a coating for the hemorrhoid. So that is a really valuable thing to think about using. Otherwise, you can get Preparation H, and that's also shown above. I've just checked, and you can get that from Walmart, and you can also get that over the counter in Australia. Now, the thing about Preparation H is it has an anaesthetic in it, and it also has an anti-inflammatory in it that actually shrinks the size of the hemorrhoids if they're external hemorrhoids. So Preparation H is also a really good product to think about. Now, the third product I want to talk about is Rectogesic. Rectogesic comes in a tube, and you also insert that. And what Rectogesic does is relaxes the smooth muscle in the anus. So that can also provide immediate relief from hemorrhoids. The only problem is sometimes using Rectogesic can give you a headache. So just be mindful of that as your side effect. I also wanted to talk about wiping and cleaning the hemorrhoids. So if you use toilet paper as your last wipe, and I'm going to use like a visual demonstration here, so you can imagine using the toilet paper over the hemorrhoid. What actually happens is you wipe and you wipe and you wipe and you can't get clean. And if you think about wiping with tissue paper, it can also too be a little bit abrasive on the hemorrhoid. Now, if you use a wet wipe as your last wipe, so I've got some wet wipes here, so this type of a wet wipe, you get them in packets like this. It actually makes it much easier to clean in and around the hemorrhoid and stop soiling after your bowel movement. It's also much more comfortable on the hemorrhoid too. So make sure your wet wipes are alcohol free. So check the ingredients, make sure aqua is one of the ingredients so that they're water based and they don't contain alcohol, which can actually irritate in and around the hemorrhoid as well. Now, my last but not least tip is to use a sitz bath or a warm water bath. Now, warm water baths at home can provide immediate relief. Ideally, you're looking at about 37 to 39 degrees Celsius or 100 degrees Fahrenheit. And just dipping into the bath, so you could have a shallow bath, or some people actually use a tub and they place it inside the toilet and just sit there for 3 minutes. That can be really soothing for the hemorrhoid and also helps you to clean as well. So that's another nice way of getting immediate relief from your hemorrhoids. So there's a lot there, isn't there? There's not just a one simple fix for hemorrhoids. There's a whole lot of things combined. They include your bowel management, they include your stool management, making sure that your stool is soft and well formed, and also to things like using your over-the-counter pain relief medications or topical ointments that will actually help to shrink the stool. And finally, we also talked about using sitz baths to actually get some relief. So I really hope that one or a combination of these things will help you manage and fix your hemorrhoids at home and get some permanent relief. So thanks so much for watching today. I really hope that this information helps you manage your hemorrhoids much better and get some fix at home. As always, if you can give the video a like below, then YouTube will actually recommend this video to other people that it can benefit from watching it as well. So thanks so much for watching today. I'll see you next time. Bye for now.